When I'll turn 50, I want people to go, there's no way he's 50.
Well, and that is the goal that we have with all of our patients, is to try to keep you, it is very much like resetting a clock. And when you're looking in the mirror, when you're looking at this, what are the main things that you see that are concerns for you now?
So, I know these aren't like super prevalent, but the lines in my forehead,
Okay.
I think that just, they jump out at me, and I just don't like them.
Okay.
But most of all, my eyes just look so tired. And
So you're feeling this is looking a little heavier, a little more saggy than what you recall from earlier. And then down here, is it this little bit of shadowing that you see through here? Is that what's...
It's the hollowness here that I don't necessarily like, and I feel like maybe there's a loss of it. Like I don't have the volume that I had throughout the front.
What we're seeing is we're just getting enough relaxation of those tissues that it's taken away a little bit of the definition. I think to summarize everything, what makes sense for you is to start by doing some contour improving procedures, and I think Ulthera would work great for you to improve both the brow position in the upper face as well as the jawline contours and get rid of some of this heaviness in the lower face as well. Once we've done that, then we can make some gains by starting to use Botox in your forehead to begin getting rid of some of these lines, and probably using some injectable filler in this volume deficit area under your eyes to get rid of some of those shadows, some of that shadowing. And if we think about moving from the top down on Christopher's face, the things that we noticed were that the brows have begun to descend just a little bit compared to where they were 5 or 10 years ago, and this is creating a little bit of a heavy look or tired look around his eyes that he doesn't like. And
so I have to draw my brows on higher and higher as I get
well,
older.
but you know, the problem is that the brow tissue itself, this tissue is very thick and heavy, and it transitions almost immediately into the upper eyelid, which is some of the thinnest skin on the body. So no matter where you draw things, if we don't reposition and move that tissue, it's very subtle, but you see how much this opens up the eye just by elevating that brow a few millimeters.
So, thank you so much. I'm excited. We're going to do Ultherapy today. I'm extremely excited to get this procedure because this is a way that I can maintain without cutting the skin. This is non-invasive, right?
Yes, that's correct.
And no downtime.
Yeah, really one of the cool things about this procedure is there truly is no downtime to it. You will be fine to go out and do whatever you want tonight.
So I can't pretend that I'm just unable to get off the sofa this evening. My husband's not going to believe it.
You can pretend.
Excellent. Well, listen, thank you so much for tuning in, everyone. Though, keep in mind, again, we are right in the heart of Midtown, high above Peachtree Street at Beaty Facial Plastic Surgery with Dr. Beaty, your double board certified facial plastic surgeon, right here in the heart of Midtown. You're like the neighborhood doctor.
We love it. Love it.
All right. Thanks, guys, for tuning in.
Yep.
I have to tell you, the Ultherapy was amazing.
Yeah, I heard that you had liked it quite a bit.
Like
and
2 or 3 days after, someone stopped me and asked me what was different.
Yeah, that's fantastic that you were able to get that rapid of a result, which, as you know, not everybody does. And the good thing is it's going to keep on improving from here. So, you know, this is fantastic.